Every 30 minutes, there is at least one new stroke victim in Ontario. Of these victims, only 10% gain a full recovery. Strokes are the leading cause of disability in Canada. And among the various causes of acquired brain injuries, strokes are the leading cause of death and disability worldwide.
So, as behavior analysts, how can we help? For starters, it is important to know that we can help.
When individuals are recovering from acquired brain injuries, especially strokes, there are different treatment plans implemented. These treatment plans often focus on speech, occupational, and physical therapy. Unfortunately, the emphasis on behavioral therapy is limited. Nonetheless, it is not non-existent, and including ABA into treatment plans is on the rise.
Let's take a look. Megan Hynek and James Carr published an article focusing on applied behavior analysts and acquired brain injury rehabilitation. Within this article, as readers, we are provided with a vast amount of information. This information allows us to gain a more thorough understanding on how ABA is seen within the lives of victims who have suffered an acquired brain injury.
Interestingly, we learned that when ABA was implemented, 60.3% of the time it was to reduce behaviors, and 37.7% of the time it was to acquire behaviors. The behavior that was focused upon most was aggression, both verbal and physical.
However, I began to question, why are these individuals so aggressive? Are they hungry? Are they bored? Are they tired? Or when it comes down to it, did their personalities change as a whole when they suffered their brain injury? Dr. Brian Goleman wrote a book called The Power of Kindness. I decided to read this book about a year and a half ago, not knowing the impact it would have on me today.
This book follows the story of Dr. Goleman as he travels around the world in search of finding empathy. Sounds interesting and maybe even a little odd, I know. But I finished this book with not only a different mindset, but one that has provided me with a new way to view the world. You're probably wondering, what does this have to do with anything? Well, within the book, Dr. Goleman states that when an individual suffers a stroke, they will experience emotional changes, especially to do with their ability to be kind. Within your cerebral cortex, there is a small region called the insula. The insula is the activity center of human empathy, and if this is damaged when an individual suffers a stroke, their ability to be kind and empathetic is hindered.
However, no physical, speech, or occupational therapy would help an individual with their ability to be empathetic towards others. You know what would, though?
ABA. Of course, we cannot train an individual in the proper way to empathize with others. However, we can teach them the different feelings associated with different events. For instance, we could develop a program where we show a client a picture of ice cream that has fallen off of the cone, and then would show the client the word sad and have the client pair those together. This is a very basic example. However, programs like this would increase the quality of life for many stroke patients and their families.
Further, I began to question why the studies that Hynek and Carr looked at focused on more behavior reduction programs rather than skill acquisition ones. The target behavior was often aggression, and in theory, reducing this behavior is the most sensible thing to do. However, as behavior analysts, we need to take this one step further and think to ourselves, what exactly is triggering this aggression?
In many stroke victims, the ability to do everyday tasks independently, such as eating, is taken away. Understandably, when an individual cannot do these tasks independently, they become frustrated and irritated, especially when it comes to food. We all know how our personalities change when we are hungry. Taking this into consideration, I believe that it would be much more significant to focus on skill acquisition programs. These programs would benefit the individual, their families, and their care teams. It would be a win-win situation for everyone involved.
Less than a year ago, my dad suffered a stroke. It was devastating and life-changing, for him and for my family. Once we got through the toughest parts of it, we had to think to ourselves, how do we increase his quality of life?
The doctors wanted to focus primarily on his physical therapy, and there was not much emphasis on his behaviors. This is often what is seen in the recovery of stroke patients, and sadly, reducing problem behaviors is often done with medication.
Do I think my dad's personality changed? It's hard to tell. My dad has always been the most caring person, and he still is to this day. However, sometimes I question some of the decisions he has made, and I wonder if the stroke impacted his ability to make these decisions clearly.
Nevertheless, not one time during his recovery was there any emphasis on behavioral therapy, and I do believe that he would have benefited from having some, as would many other individuals in the same position as him. This is where we, as behavior analysts, come into play. We need to advocate for these victims. We need to prove that our programs would most definitely increase the victim's quality of life. We need to remember that although these individuals are most likely older, teaching them basic functional skills is just as significant as it would be for a 3-year-old. Although the studies on ABA and acquired brain injuries has significantly increased, we need to continue to do research, develop programs, and support each other while doing so.